Great. Hello, everybody. Thank you so much for joining us today. I'm going to give you all a few minutes to join, but we are so excited for this conversation. So we will get started very soon because we have a lot to cover over the next hour.
Deep breath.
Yeah, deep breaths. Everyone, make sure you have a glass of water, perhaps a notepad and pen.
Your book.
Your book.
A highlighter. I have mine in front of me. I'm like, yes, we still highlight everything. My nephews this weekend was like reading through, I was like going through this and like highlighting stuff I wanted to pick out. And they're like, why are you tracing in your book? I'm like, is that a girl book or is that a boy book? I'm like, it's definitely a girl book, but boys should also read it.
Yeah.
And they're like, why are you tracing? And I'm like, because I need to. Just leave me alone. Like they're 4.5. And I'm like, leave me alone for my like coloring. Oh man. Just some easy beach reading, you know. Oh, people are trickling in. I can't see a thing, so
It's okay. I've got it. I've got it under control. I think we'll get started with my little introduction and my housekeeping notes, and people can continue to join while I look for it. So again, thank you to everyone for joining us this evening for our special crossover episode of Dr. Heidi's Book Club and TABU's Office Hours. My name is Steph. I am the VP of Operations at TABU. I will be handling all of the questions today. If anybody has questions, feel free to click that Q&A button at the bottom center of the Zoom window. And I will make sure that you all get links to everything we discuss as well. So we are going to be having a conversation this evening inspired by the book It's Not Hysteria, written by Karen Tang. Don't worry if you haven't read the book, it will still be a very interesting conversation. There's plenty to learn about the history of women's healthcare, including the origin of hysteria, and the invention of the first vibrator. So some housekeeping notes before we get into the conversation. While Dr. Heidi is a fantastic doctor, she is not your doctor. So please do not take this conversation as medical advice. This is for informational and educational purposes and will hopefully allow you to have more productive conversations with your healthcare providers. It is my pleasure to introduce Dr. Heidi Gassler, a Herman and Wallace trained pelvic floor physical therapist and the founder of Mountain to Sea Physical Therapy, which is located in Los Angeles. She does offer telehealth, so don't worry, you don't need to be local to work with her. And maybe most exciting, one of our very first medical advisors at TABU. Lovely to see you this evening, Dr. Heidi.
you too. It's been too long.
Agreed. And it is also my pleasure this evening to introduce Natalie Fretwell, who many of you already know, the founder of TABU, which she started after an enlightening, if awkward, conversation with her mom about sex and the intimacy challenges women face as our hormones change over time. Her goal and our goal is not only to provide clinically backed tools to help make sexual wellness a normal part of our routines, but to also provide a safe space for women and their partners to ask questions and learn about all things intimate health. So without further delay, Natalie, please take it away.
Thank you, Steph. It's fun being on this side of the and not having to do that. But you crushed it. Thank you, Steph, for taking such good care of us today. Dr. Heidi, let's start by giving us a 2-minute highlight reel of this book for those of us that did not read it, but are really interested in it because I think it's such a fabulous topic. And I'd love to hear kind of your highlights, your highlight reel, your key takeaways when you were diving into this. I know you have like copious notes, but if you were to give us like a 2-minute overview, what would you say?
So if you have read this book, just ready for like a long dive into a lot of these topics. If you haven't read it, these are your reasons to read this. So part of our collective mission between myself and with Natalie and Steph with TABU is that we're trying to normalize these conversations with women and women's health. And we've been doing this since the inception of office hours back in what, like 2020? It's been
oh God, it's been a long time.
I'm like, when was the last one? Anyway, so in the office hours were really my inspiration for starting a book club because so many people, myself included, have all of these great women's health books like sitting on their nightstand or sitting in our Amazon carts, but we don't actually take the time or the opportunity to read them. And I really wanted women to have an opportunity to get that off the nightstand, actually read the book so that we can be more empowered in knowing our own bodies, knowing this information so we can actually go and talk to our clinicians. And this book is absolutely fabulous. It's called It's Not Hysteria by Dr. Karen Tang. And this book basically goes into the history of women's health and every single diagnosis that was categorized originally under the umbrella of hysteria, which, as Steph told us before we started this meeting, she had a hard time getting in this book because it was just making her so freaking angry. And it should. I mean, for a long time, this was such a blanketed term. It was covered up that we are broken, and we are not broken, but that we have all of these things that were making us hysterical. And if you don't know what the DSM is, essentially it is the diagnosis codes for psychological disorders by mental health professionals. And hysteria was an accepted diagnosis code until 1980. That was the year I was born. Okay. And I'm 45 and I'm getting older, but like that wasn't that long ago. Like we think about this like, oh, maybe in the 50s. No, 1980 was when this was finally taken out. And so what this book does is it goes into the history of a lot of this and the history of some of the absolutely insane things that women went into in the service of trying to come up with actual diagnoses. But then it goes into chapters on all of these different diagnoses that we now know are like real things. And it goes into symptomologies and symptom kind of perspectives. So if you kind of read this and go, wow, I feel like I fit into that category, you might have a more enlightened conversation with your medical provider and bring it to them, go, hey, listen, I read this book with very real information versus the stuff that we see all over social media and we don't know what's real or not. But it gives us very real information to bring to our doctors and say, hey, I fit into this symptom category. And these symptoms maybe that my mom and my sister and my aunts had, and I thought were normal growing up. Or maybe these symptoms that I'm told are normal, maybe they're not so normal. Maybe there's something I can do about it. And it goes into all of the different diagnoses and breaks them down. They were all originally classified as hysteria, which is why the title, It's Not Hysteria, is actually something real. So that's what I love about this book. And part of why I asked Natalie to come on here with us, with me today, so that we could do this cross collaboration is that they have, again, been trying to really hard to normalize these conversations. But also one of the tools that we have in our disposal, in our arsenal for a lot of different conditions is using the medical vibrator, medical dilators to help us with the symptoms in the pelvic floor. And Natalie has an amazing story that I want her to share with us here about how she came up with the name TABU and how she came up with the concept for this brand, because it involves exactly this, normalizing these conversations and breaking down these kind of generational stereotypes with our women's health. So if you could tell us more about that, I would love it.
And it's funny because I've been at this for 5 years now, and I had never heard of this idea of hysteria as, you know, a thing that our Victorian ancestors dealt with or came up with, or just like this idea in general, until Dr. Heidi told me about this in this book. So I feel like I've been out of the loop of this important part of history as it relates to my own company. But so let me give you kind of the, you know, kind of hopefully an abbreviated version of how we started TABU. So I'm a marketer. I've been a marketer for the bulk of my career. I started in DC. I moved to San Francisco. I joined a startup. And I've always been in health tech for the most part, before most recently finding my, I guess like what felt like my home at the time at an investment firm down in Los Angeles, that was really focused on building thoughtful consumer brands and platforms across a variety of different verticals. And being at an investment firm, you get to see a lot of ideas and you get to see a lot of amazing players playing in different categories. And while I was there, I would say the menopause category started to really heat up, and people were, importantly and probably too late, really paying attention to this season in life. And I will admit at the time, I thought menopause and hot flashes, and that was like about the extent of my menopausal knowledge as a 30-year-old woman, which I'm ashamed to say today, but that's just the truth. And I learned some outrageous facts about how prevalent the sexual health side effects specifically of menopause are, to the tune of up to 90% of women can experience pain or discomfort during sex, so much so that 50% of us just stop being sexually active altogether in our 50s. Those numbers change later on in life, and of course, there's a lot of different studies that tell you a lot of different things, but all I heard was like, wow, big numbers, big problem that I've never heard of before, and I'm a woman, right? And so I remember it was a Tuesday. I don't know why I remember that detail so clearly, but I hung up the phone of this pitch and I called my mom. No, excuse me, I didn't call her. I texted her and I said, hey, do you or your friends have pain or discomfort during sex? She laughed at me for a while, like lots of ha-has, before we had a really sobering conversation. She knew exactly what was happening to her body, admitted it wasn't just physical, but deeply emotional, really affecting how she feels about herself and her relationship with my stepdad. And truly, I was stunned. It quickly dawned on me this was the first sex talk I'd ever had with my Muslim Middle Eastern mother. My mom was born in Syria, raised in Syria. We don't talk about this sort of thing. But I was almost bothered that I consider my mom one of my dearest friends. We are so close. And even though we don't go there, I felt bothered that I had no idea that something so meaningful was going on with her life. It was clearly affecting, her confidence, her self-worth, her relationship, and ultimately her health. And so I became kind of obsessed with this problem. And I started talking to anybody and everyone that would give me the time of day, from my aunts, family, friends. My mother-in-law and I have gone there. And I learned that so many women in my life whom I loved were feeling just like my mom. Like, it was one of those awkward conversations where at first they would be like, Nat, why are you asking me this? Like, this is so uncomfortable. To right when you're about to hang up the phone, they're like, hold on, how much time do you have? Let me tell you everything. And then it was like hard to get people off of the phone. It's kind of like once you kind of opened the door a little bit, like the floodgates would open. And I knew like something was here. I was like, I don't know what's here, but this is clearly like feels like an unmet need among a really important and frankly young population of women. And so my next move was to talk to doctors like Dr. Heidi. And I learned everything I could learn about this problem. And I learned so many things, from hormonal-based solutions, non-hormonal-based solutions, how prevalent this is in their own doctor's offices, and what types of things that they're telling their patients. And one of the things that I heard over and over and over again was that many doctors are recommending women use regular sexual activity, or what some doctors would call a sexual wellness routine, to treat and prevent the very symptoms that are keeping us from sex in the first place. That's things like, dryness, atrophy, incontinence, low libido, low body confidence. It's not a catch-all it's not like a singular treatment for everything, but it's kind of using vibration therapy or vibrators as key to a treatment plan to help solve some of these things that we're experiencing as our hormones change over time. That's most prevalent in peri to postmenopause, but also prevalent in other parts of our life, like postpartum as an example. And so in practice, that means that you have doctors telling women to go out and buy a vibrator, lubricant, and really think of sex differently. Think about it as part of your overall wellness routine. I joke all the time that my mom, still to this day, even though her daughter runs a sexual wellness company, can't say the word vibrator out loud. So she's certainly not going to do that. And at 50, I have a really young mama. She was assumed this part of her life was just unfortunately over. And you would hear things like, that's just what happens when you age, right? And that's really the challenge and the opportunity we saw with TABU, was could we create a brand and product experiences that really celebrate and honor sexual wellness as our bodies change, with products that feel more akin to what you'd expect from a high-end skincare brand than a sexual wellness company, curated and personalized resources so people understand, why they're doing what they're doing, and connecting to experts like Dr. Heidi to help you, ask questions along the way. We have a lot of products today, not a ton, but we have many. And all of them are really designed to tie to specific symptoms that you may be experiencing. So when you come to TABU and you think, I think I need a device to help with something, the question is not, do I like the pink one or the purple one, which is often the question at many of other websites that sell these sorts of things. But it's really like, what issue am I presenting with, and how can we help you understand how the right tool can help alleviate that issue? Is that enough? Does that make sense?
Awesome. I think that like kind of leads us right back into like, the history of like the marketing of this. Like, you have a very specific story of like, I created this, and like you created it with like, what was it like? Didn't you have like a marketing group of your mom's friends like that like helped?
Oh my gosh.
It's like you're creating it for this very specific window of life. And really it's like, for people who've seen Grace and Frankie, this has always reminded me of like the real life version of Grace and Frankie's like tool that they made for like arthritic wrists.
And I did DM Grace and Frankie and say I stole your idea, and I have never received a call back. So if anybody knows them personally, I would greatly appreciate an intro. But you're exactly right. I'm really like, when I think about my target consumer, it's somebody who would never dream of buying a vibrator because they didn't think that it's made for them. They don't think it's made for them. And that's not to say that I think there's any shame in buying vibrators. Like, that's not at all what I mean. But when you're designing something, you're thinking about who that target customer is. And I think that as you guys know, there's so many products out there, right? There's lots of toys. And I really didn't want to make a toy. I wanted to make tools. And that may just feel like a marketing distinction, but it really is I think it's really important because it really helps people understand that these things belong in your health, in a health context. They don't just belong in a play context. And that I think is a really important distinction, because if somebody's suffering from dryness or atrophy or many of the things that hysteria is a catch-all for, right? You're not in a place for play. You're not in a space for like, you know, to receive pleasure in that way. You're in a space for how can I fix this problem, right? And so I want to help you understand that using these devices can help you fix that problem. And if it feels good too, that's part of the fix, right? That's part of the solution. Like it feels good on purpose. And so I think that that shift is, like we often say internally, is like we really put health before pleasure. And that's not because we don't think pleasure is important, but we want you to help understand the health part first so that you can receive the pleasure part.
Well, like the original people who created the vibrator, like this was marketed as like a health and wellness tool, and like a beauty tool. And so like literally, I don't know if we can talk over like that slide that you made, but like the marketing for this, if no one's seen this, like just Google like early 1900s like vibrator marketing, and you're gonna like just laugh your socks off. It's like literally was like everything from like your glowing skin to like a headache cure to like all these things. And they literally were making these things where they were marketing it. You can see very specific terrible female marketing. Give it to her. Okay, seriously, like that was one of them that just made me die. But like it's like for the headaches and for like the beauty. And there was one I saw that was making your skin better. And they're all like these like things where they couldn't say sexual, right? And like it was all things that were very like repressed and taboo, if you will. But they were using it and they were getting it, really figuring out ways to market this specifically. This is for women. But go back to Dr. Granville, who, if you've seen the movie Hysteria, which I mistakenly thought was a documentary, and it is definitely not a documentary, but it's the whole book or the whole movie is basically a dramatization about the starting of the vibrator. But they literally, in actuality, he was using that on men and doing for like men's circulatory issues and male pain. And then the history is kind of murky here, but then it was eventually being used for treating hysteria because they knew that the paroxysms of female, of the female, they weren't really thinking of it from a joy perspectives, but this paroxysm that they were seeing, these women were coming back and saying like, all of these symptoms improved. And it's all of these symptoms of hysteria, everything from, from pain to like a loss of their voice, to headaches, to, my husband said that like sex wasn't good. I mean, you name it, there's all of these different things. And this went on for a long time. And then hysteria takes a really dark turn. There's a lot of stuff in like early 1900s where there was the rest cure, where women were locked in like mental asylums for the rest cure. And it takes a really dark turn. And like there's stuff from older, stuff even, and also like from like ancient Greece and also from different cultures. And this gets really kind of dark, where they did things like clitoridectomies, where they were literally removing women's genitalia, thinking that this was going to fix them. There's also some things that weren't as dark, but equally as like astounding as the term the wandering womb, where they used to literally think that the womb wasn't satisfied because it wasn't getting pregnant, it wasn't having sex. It would wander around the body and create these like maladies, and that you had to do something to appease the womb, whether the sexual activity, something as stupid as holding honey down by the vagina to like try to coax it to come back down, something sweet. I mean, some really outrageous stuff. And you think about this and go like, wow, like this is what medicine was. But then, the whole vibrator, it turned into like a very like sexualized thing for a long time. And there's the Hitachi magic wand that everyone knows about. And then Sex and the City blew that up, with, Samantha. It was Samantha, right? I always feel like I get them wrong. But anyways, they blew that up. And then now we've kind of come full circle here, where now we're like talking about, and I talked to all these different companies like TABU and with Natalie that are making tools and sexual wellness tools to treat a lot of these symptoms. And specifically, we're treating a lot of the symptoms of GSM. So all of the postmenopausal vaginal atrophy, dryness, pain with sex, etc., with these tools. And that can also be things that are external pain as well, where people are having like vulvodynia or vestibulodynia, where we're having pain external with the external genitalia, as well as with the vagina. And like, how many times in office hours have we had women come and say, I think my vagina disappeared. I think it closed up.
Yeah.
We just don't know any better. And so trying to normalize these conversations is really helpful. But also, you know, with tools that are involving helping women to find and achieve orgasm again, because it feels like your orgasm disappears, our libido
This is
changes.
what paroxysm means, by the way, guys. Like
Yeah.
that's
I
what
should
it
have explained that.
is, like,
Paroxysm,
orgasm. Like,
orgasm. You know,
yeah.
they thought it was like, looked like you're having a seizure, but that's what thank you for clear.
Yeah. No, which I didn't know. I was reading about this and I was like, wait, that's what that means, right?
You're like madly Googling what the hell.
Aside Google, like I'm sure I'm understanding this correctly.
You're like, Heidi, what the hell's a paroxysm?
Yeah, no. I remember that, but I think the other interesting part before you go on that I want to mention is that back in the day, people, let's like, you know, the primary this profession, like physicians were primarily men, so our understanding of the body was primarily through a male's eyes, and they believed that women only experienced pleasure by penetrative sex, which we now absolutely know is not the case. And so because they were just using the like primarily the pelvic massage was external, they were like, oh, this isn't sexual. So whatever response you're having is not pleasure, or sexual, it's just therapeutic, right? Which is a funny distinction, right? Like the fact that those things need to be separated when they're certainly not. But I think that's really interesting to consider too, because like obviously we know better now, but that's how they kind of rationalized, right, what they were doing, because they're like, well, it couldn't be feeling good or it couldn't be sexual because the only way you know, us women receive pleasure is if something goes inside, which we now know is patently false.
Patently false.
Yeah.
But that's an interesting thing too, because one of the things that a lot of women know, you know, don't know, and I would love if you could show a show of hands here, and like, you don't have to, but if you've ever taken, okay, a mirror and you've looked down there, like who knows here, like what they look like down there? Because so many people don't even know their own anatomy.
I don't.
Like, yeah, like if you don't know this, okay, after this call, if you take nothing else away from this, get yourself a handheld mirror and get to know what you look like normally, okay? The number of women who come into my office, whether it is it's postpartum, during pregnancy, after pregnancy, in menopause, in perimenopause, it doesn't matter. And they're like, is this normal? And I'm like, it's normal, but I don't know if it's normal for you.
Yeah.
And I'm like, here's a mirror. And I'm like, is this normal for you? They're like, I've never looked. I have no idea. So like one of the things, like as a clinician, it's so important is actually knowing your own anatomy and knowing what you look like. And it doesn't mean you have to like get all detailed here, but like knowing what your labia look like. You know, one of the things that so many women are concerned about, like so many things, is do my labia look normal? And like, do I have odor? You know, do I smell? Like these things. And like the question for me, like, does my like clitoris like look normal? Like, do I have hemorrhoids? If you don't know what you look like, it's really hard to describe to a medical professional and to know if there's something right or wrong down there. And so knowing our own bodies, and part of like us becoming better self-advocates, is actually knowing what we look like. And as uncomfortable as that might make you, this is really important, especially for in the pursuit of improving our women's health and sexual health, is knowing our bodies and knowing what we look like down there, and knowing that every single person's labia look different, and what your labia looks like, and like your next door neighbors and mine or Natalie's, whoever, ours are all going to look different. Okay. And as long as they are pink, okay, it doesn't matter what color pink, but as long as they're pink, they're not like splotchy and white. Okay. And as long as they look like they've got good blood flow, you're fine. Okay. If there's something that feels like there's wrong, like it's itchy, or you have like a bad kind of fishy odor, not like a normal odor, like I just wasn't worked out. Okay. That's totally normal. Okay. But something that you're like, wow, that's a little bit more smell than I usually have. All right. Whatever, like something's different, then that's when you kind of go, okay, I need to make an OB appointment and go and like get an examination and get looked at. But if you don't know that about yourself, it's hard to have a starting point. And with the idea of pleasure, okay, one of the things with using a tool that has a vibration is that it actually will help to draw in engorgement of blood into an area. And this is really important because when we're trying to treat a lot of conditions, if we have more blood flow to the area, that can help with treating a lot of conditions. And not only in the external genitalia, but also inside the vagina as well. And if you don't know this, don't feel bad, okay? The external genitalia is the vulva, okay? So when you see something like a vulvar moisturizer, that is an external moisturizer of the labia majora, which is the bigger lips, and the labia minora, which is the inside thinner lips. Okay, it's not meant to be an internal product, but it's to moisturize that area, because those areas, just like our face, they just get dry. So like, you know how we slap on like hyaluronic acid and we do this and that, whatever, it's just kind of the same concept for down here, is like we're moisturizing those tissues. But by using something with vibration and something maybe that has heat or something, we can actually help to draw more blood flow into that, which can help to fix a lot of issues, especially when we're going through times of hormonal change. So this would be when I'm breastfeeding. Estrogen's way lower. During perimenopause and menopause, estrogen and hormones are way lower. In postmenopausal, our hormones are like axed, okay? And so a lot of times people ask like, well, what's the difference? So perimenopause is the years leading up to menopause, okay? And that could be like a 10-year span. And that can happen earlier or younger. I just met a woman this weekend she's 25 and she's already going through it. So don't necessarily think that you have to be 50, but it could be based on genetics. It could be based on other health factors or stress, other things that you've got going on. But it can start at a variety of ages. And so these symptoms, you start having these kind of more wild fluctuations of symptoms. Maybe your hormone or your cycles become more irregular. And there is no like lab testing for this, okay? And so the important thing to know is that we're doing a diagnosis by a symptom collection. But if you go and have your hormones checked, whether you go at 8 a.m. or 12 p.m. on the same day, you've eaten, you've not eaten, or you go to a different day of your cycle, we're looking at a snapshot of your hormones, and it's going to be all over the place, which is incredibly frustrating, because if you're trying to diagnose this, looking at the symptom collection more so than we're looking at lab work, okay? Then menopause happens 1 year. What menopause is on one day, 1 year to the day that you've gotten your last cycle. Okay, so if you didn't have your last cycle April 12th the next year, and I'm saying this because it's my day, April 12th the next year, it's your day of menopause. And then anything after that is postmenopausal. Hopefully that kind of clears up like that distinction. But we have these different times in our lives where our hormones are lessened. And so during those times, we can get all of these kind of GSME symptoms. So vibration and heat being used externally as well as internally can help with treating these symptoms. Now, internally, this is something a lot of people don't know. And a lot of people have pain with internal penetration. So our vagina is a tube, okay? When our tube is not stimulated, it's kind of collapsed down. And if you've ever felt inside of there, it feels kind of rough. And those are called the rugae, right? That tissue is basically just collapsed tissue that is meant to be stretched out. So as we get engorgement of blood, our vaginal barrel actually gets longer, and our cervix actually moves away from our vaginal entrance. And so the tube gets longer and it smooths out. So this is why if you have an IUD placed, if you are not aroused and you feel up inside yourself to feel where the strings are, you can actually find them. But during sex, those are pulled way, way up because the cervix actually migrates upwards. So when we're having symptoms of like vaginal dryness or atrophy, et cetera, if we're doing internal stimulation as well, we can actually help to draw blood flow into that and help that tissue inside get more blood flow so it can become more extensible. And if we have muscular tightness, which could be anything from like GSM, maybe you've had some sort of trauma, maybe you had chemo, radiation, hysterectomy, oophorectomies, maybe you've got fibroids, endo, you name it. These are all of these different symptoms of hysteria. Using tools like these inside and out can help with treating a myriad of these symptoms. And so I think that this is a really important thing to know, that these are now medical tools that we as pelvic floor PTs may be asking you to do and be using at home, if you're so comfortable doing it, to treat all of these different pain-related symptoms. That also ties into incontinence, which I would say is probably besides pain, is probably the second thing that we get asked about the most in office hours. And a lot of times people think that if I have incontinence, it means my pelvic floor is too weak. And it may be, or it may be that it's just disconnected from your brain. However, incontinence, there's stress urinary incontinence, meaning I cough, sneeze, laugh, jump, and I leak. There's urge urinary incontinence, which means I can't make it to the bathroom. I have the urge to go and I just can't hold it. And then there's mixed, meaning it's a combo platter of both things. Okay. But if your pelvic floor muscles are too tight, it can also, or if you're like holding too much tone all the time, it can make it that you're having increased incontinence symptoms as well. So using a tool like this to help to relax the pelvic floor bowl can actually help with those urinary incontinence symptoms as well. So if you're asking, people are like, why are you teaching me how to relax? I'm already relaxed enough. Well, you might not be, because if you're walking around trying to hold it in all the time, you might not be able to actually hold it in.
Yeah. I'm so glad you walked through menopause because since, starting TABU and kind of obsessing over this season in life, I've learned so much. And the primary thing that I've learned is that no matter if Oprah's talking about it and Halle Berry, it doesn't really matter. This is a group that people overwhelmingly do not want to belong to. Like, they don't want to say they're menopausal. It makes you feel like you're in a late stage of life, when in actuality, it's a catch-all term, and it's probably like misnamed because it's such a big part of our life, right? Like, it could be everything after 35. I'm 35 years old. I could very well be perimenopausal right now, and it represents such a huge portion of our life that instead of obsessing over, okay, this is something I need because I'm menopausal, let's like reframe that and say, like, okay, this is something that I need because I'm going through X, Y, and Z symptom, which is a super normal part of being a woman. And it could happen because I'm breastfeeding. It could happen just because I'm naturally drier than most, or than some, rather. It could happen for a whole slew of reasons, right? Like, it doesn't necessarily mean that you're nearing the end. It doesn't mean that there's something wrong with you. It's just a fact of life and of biology. And I think that I think this book brings up, even if it's like the hilarity of the framing of hysteria aside, like, they're very real issues, right? That people are experiencing or have been experiencing for a long time, like anxiety or insomnia or fatigue, or these things that are not necessarily exclusively for women that are, 65, that are experiencing those things. Like, these things could be things we're experiencing for much of our life. And understanding how paroxysm or whatever can help alleviate those things is really important. And I think that it helps put this part of our life in the same category you would diet and exercise and, taking care of your skin, or it just puts it in the camp of like, these are things I do to live a healthy lifestyle. And it's not to solve one thing. It can really help overall how I feel.
Definitely. And like these problems, like there's pediatric pelvic floor PTs, by the way. And there's ones like, and I don't do any vaginal exams on peds or teens, and I don't really do pediatric pelvic floor PT, but I do have a lot of really stressed out young people, like high school female athletes who come in here, and they might be coming in for their shoulder or the knee or whatever. And, we'll get to know each other a lot. And like, they'll come in, and where I live and where my practice is, there's a ton of beach volleyball. And this has come up so many times where, hey, Dr. Heidi, can I ask you a question? And like, you can kind of tell, like, it's either going to be about something like, I don't really want to know about like your boy problems, or like whatever. But I'm like, is it about self-harm? They're like, no. I'm like, is it about drugs? No. I'm like, okay, shoot. So about those two things, like, you all know I'm a mandatory reporter, so you're welcome to tell me, but then I'm going to have to call your mom. Okay. So we just need to lay some framework. And they're like, all right. They're like, so everyone on my volleyball team wears panty liners to practice. I'm like, okay. And they're like, it's because we all jump, and when we land, we all pee our pants. Is that normal? Because our coach says it's normal. And I'm like, dear God, that's not normal. Or kids will be doing, like, for any sport, they'll be doing like a stress, like VO2 max test with the trainer at the beginning of the season. And they keep having to repeatedly hose down the stationary bike because all these kids are peeing their pants on the bike when they get to that level of stress. And the level of stress that our society and these kids have is massive. And this book, and one of the overarching factors you see chapter in, chapter out, is like how much stress management can help with managing all of these symptoms, even if it's something that is going to end up being like potentially a surgical type of intervention. Maybe we're looking at endometriosis surgery. All right. They're talking about how like just the stress that we have as individuals can actually make these symptoms not only feel worse, but get worse faster. And so much of that has to do, and like so much of what I do in the office is teaching people stress management techniques, breath management techniques. How do we breathe? And with these teens, it's stress management and how do I breathe down into my pelvic floor to help to get that thing to relax down. Because if I can get that muscle to be more of a trampoline when they're jumping versus just being a rigid floor, they're less likely to leak. And that goes with so many other people. We need to learn how to coordinate our breath and our pelvic floor, but then everything in between that's in there, our uterus, our intestines, like everything that's in there, that all gets impacted in that same canister. And that kind of leads me into wanting to mention like IBS and like and poop problems. Okay. And anyone's been around here for more than once, like, I talk about poop problems probably too much, like maybe an uncomfortable amount. But it's so important to know that like if we are backed up and constipated, it will make every one of these symptoms feel worse. Okay. Women need to poop. It is not unfeminine to poop, but it is a very feminine problem to number one, not want to bring it up with your doctor. And number two, to not want to talk about a period or acknowledge, like you said earlier, acknowledge that there's a problem here. But if you are full of poop, it will push on your bladder. It will push on endometriosis. It'll push on fibroids. It just essentially takes up more space. So if you have to poop and you're all backed up, you're probably going to feel like your incontinence is worse, or your pain's worse, or pain with sex is worse. Any of these things. So like constipation and bowel management are things I work with people on at any age all the time as well, because it impacts so many of these elements. And they talk about, again, stress management is a big thing in here. Diet and lifestyle factors are a big thing throughout this book of like what are surgical, like non-medication alternatives, like medications and surgeries we talk about when we need to, but lifestyle factors and constipation, diet, stress management are all huge overarching themes in here. But that really honestly like replicates so much of what we talk about in pelvic floor PT too, and within like the medical world of if we aren't doing these basic things for our body, it's really hard for us to do the treatment stuff. So, and treat things. So
Totally.
Right.
Totally. I think too, sorry, Steph, do you have a question?
I would love to jump in with a question we got from the registration form, actually, that came to mind when you first started talking about the mirrors. And selfishly, I'm very interested in what your answer to this question is going to be. So somebody wrote in and said, what routine care do you recommend to check my reproductive health in my mid-30s?
Number one, for your reproductive health, I'm assuming you're talking about like eggs and fertility stuff, but I'm not 100% sure.
They didn't specify fertility. So again, selfishly, I'm interested in your like umbrella intimate health answer as someone who's not interested in fertility. But
so
however you want to approach.
Sure. I think that number one is like starting to kind of track your own body and symptoms. So hormone tracking, knowing what you look like down there, just like starting to kind of know yourself so that if something feels amiss, you have an earlier cue versus it kind of taking you by surprise when it gets to be such a big problem that now you can't ignore it. And then going in for like your annual visits, like just that annual women's wellness visit, those are important. And they're no longer doing like pap smears every year, but so many things that are preventable can be caught in that women's wellness visit. Okay. And along with that goes like, without talking about like just vaginas in general, but doing your breast self-exams. I mean, those catch so many things so early that do your breast exams. I mean, people are like, oh, I hate doing that, but like, just do it. Like in the shower, easy, you're soaping yourself up, do yourself an exam. And just, again, knowing what your breast tissue feels like, you're going to have a much earlier sign if something doesn't feel right, something hurts, there's a lump or bump or nodule. And honestly, those things cannot catch things even before like a mammogram. And if you're 30, you're not having mammograms yet. And so like catching those things might give you a reason for you to go to the doctor and say, hey, I think I need to have a breast exam. But women's wellness visits, know yourself, cycle tracking, knowing what you look like down there, I think are really good things. And if you do have a problem, this is really important. If you have a problem, and if you're trying to go to the OB, okay, know that your visits are going to be very, very short for a women's wellness visit. And this is incredibly frustrating to a lot of people. So if you think you have an actual problem, then you want to call, when you call to schedule, make sure you're scheduling a problem visit. Make sure that they know you're coming in for a specific thing. So they book an adequate amount of time to discuss this with you. I went in for a problem visit maybe a month ago, and I was with my OB for an hour. And like, when's the last time anyone was like, I was with my OB for an hour, and I have all of these symptoms of like GSME nonsense, like all post-menopause, post-chemo induced menopause. And they spent an hour with me. And not only that, then she followed up with a colleague who I'm going to be seeing in August, because they're like, we're making sure we get to the bottom of this, and nothing you're telling us is something we're going to dismiss. It's not like I'm dying or anything, but it's really annoying and affecting my life. And this is what I do for work. And I'm like, let me tell you about my problems. And she spent an hour, but I made sure I booked adequate time. So we had that time together, and she was really invested in this. But that's the kind of thing that we should be doing, is making sure we're communicating. We know that there's something, and that's why we want to self-educate. So then we know there's something, then we can go in and really dive into it with our healthcare provider to then get this show on the road versus just silently suffering. And all the stuff I'm having, like, I mean, I knew about it from work, right? But like, I didn't ever have like a female relative go through any of this. My mom, we don't talk about this kind of thing. It's not a relationship. My aunts, they're the ones who I asked about tampons, yeast infection, et cetera, but they didn't go into menopause until normally in like their mid-50s. And so just like age differential, I didn't have someone in my family to like really ask about it. So thank God, like I speak doctor, so to speak. So like I can go in and talk about this, but for everyone who doesn't, or if you're like me, you don't have a family member to ask, that's why we want to read and educate ourselves with information and know that there's so many resources and so many people like us are trying to start having this conversation. But for me, and I can only speak for myself out of this like trifecta here, but when I'm here in like work mode, I feel like I'm in this vortex of vaginas and menopause and women's health. Okay. Like I feel like I'm in the center and the eye of the storm of this vortex. Okay. Everything around me is like vagina, vagina, vagina. And I'm like, this is awesome. Okay. But then I take one step outside of my own little vortex and no one feels like they're talking about it. And everyone I talk to is like, I don't know what you're talking about. And so it's like, we need to still have more voices and we need to have more reach out here. And hopefully this conversation inspires everyone else here to be like, tap a girlfriend, like you want to know about this. But I hope that that kind of answers your question. I'm sorry, I went super tangential, but I think that's a good opportunity to like ask, like, are there other questions we haven't gotten into with our last couple minutes?
Let me see.
Or
I mean, one that I
have
think
a
is really
question, it's a good
interesting.
time to throw it in the chat.
Yeah, please. If anybody who's with us has questions, please click that Q&A button. We'd love to answer them. One question I think is really interesting, and I already know I'm going to love your answer. Somebody asked, will using a vibrator regularly replace Kegel exercises?
No, I wish it will not. But it is a little bit of, we love this. If you don't use it, you will lose it. Okay. So it doesn't mean your vagina is going to close up. Okay. But if you are using a vibrator, okay, and if you're bringing yourself to orgasm, or if you're not even getting to paroxysms, then we're just going to keep using that word all the
I
time.
love it. I'll probably get through ads. I should probably start using it.
Can you describe a paroxysm? And I'm going to be like over here, like Moira Rose or something, like throwing my hands. Whatever her character is in Beetlejuice, that's what I kind of feel like. It's like start doing this business. Anyways, if we are having success, okay, sex begets sex. If we have a good like experience, okay, whether this is self-pleasuring or with a partner, and you could be coming at this point like, I'm treating my vagina, but hey, that feels good. And hey, I had a successful experience that didn't hurt. It felt good, whether I did or didn't achieve orgasm, that is a successful endeavor. And when we have success, then we tend to get that buy-in of feeling success and having more and more. So we do have a lot of achievements with using a vibrator, with having the ability to alleviate some of the GSM symptoms of pain, vaginal atrophy, muscle tightness. And if my muscles are, again, more flexible, my Kegels are going to be more successful. And so then that way, those two things can kind of feed in together, because if I have more muscle movement, more range of motion in my pelvic floor muscles, I can get more power with my Kegels. Okay. If I'm already like here, I can't get a lot of power. So we need to be able to get that range of motion. And in that way, using a vibrator or using like a sexual wellness routine and Kegels can definitely interplay to help with treating a lot of our things.
Thank you so much.
What else we have?
What else do we have? And Natalie, if you have anything you want to jump in with as well, please do. One question I actually can answer, which I'm thrilled about. Somebody asked, is there help or support for women that are postmenopausal? Everything I see is related to perimenopause or menopause. I don't see much about life after menopause. My suggestion would be make sure that you are subscribed to both Dr. Heidi's and TABU's email newsletters and come to office hours every month. And I will make sure that I send you all of our past sessions to watch as well. But of course, if you do have anything to add, just in my experience, this is kind of the best resource and community that exists for this group of people.
And just a reminder that like these words kind of suck. Like if you're postmenopausal, you could likely benefit from the information for perimenopausal women. Don't get like too caught up in the nomenclature because it can just confuse you. I had an advisor one time say to me, Natalie, stop saying postmenopausal X or whatever. That's like me telling you postpubescent. Like I don't think about my body as a postpubescent body. It just like is my body after 15, right? So I think about it and you can think about this in a similar way.
And like I'm totally postmenopausal and I don't think of myself in that way unless I like go to the doctor and I'm like, yo, postmenopause here, like help a girl out. But like I'm not like walking around all day like thinking like I'm in this category. It's just like annoying. And because of my own patient experience and my experience with Natalie and with TABU and doing these office hours, I was like, it'd be really great to create an extension community and like help more women because we need more voices and like actionable, like real info. And like something that kind of like leads me into Natalie, is you and I had talked about before this about like the concept of like snake oil. And we haven't talked about that yet. And this is something like I think we both feel pretty strongly about. And do you want to like talk about this a little bit more? Because I think that this is important for like this community to know, like we're trying to break up some of this like, scary words, but also like, let's talk about like what things you might see out there that might actually not be just total BS.
Yeah. Like I think we were talking about this in the context of a vulva moisturizer, which we briefly talked about earlier. And sometimes I pass ad ideas over to Dr. Heidi because she's my first eyes on some concepts. And I said, what if we tried to talk about how, big pharma will tell you that a vulva moisturizer is snake oil because like they really want to push hormone-based products. And that's not to say that I think hormone-based products don't work. There's like absolutely a place for them, but it's also true that some people are either not interested or just don't want to do it or feel like they're not candidates for it, right? So you kind of have to create space and products for all sorts of people. And the fact of the matter is that a vulva moisturizer may be somebody's snake oil, but maybe somebody else's saving grace. And so you have to kind of break away from a lot of the personalities that are trying to push things at you. And I frankly would say that a lot of doctors online also make, their fame over, poo-pooing different ideas. And you really need to, if you're experiencing something, it's worth trying a lot of things and it's worth trying to figure out like what works for you. Because I think that there's such a mind-body connection when it comes to our genital health and our GSM generally, or just like our intimate health in general, that it's not fair, I should say, for somebody to say that's absolutely not going to work for you. Because if something is at least science-backed in some respects, or you feel confident in the brand, or you feel like there's some substance behind it, it might work for you, but it might not work for somebody else. So I think that, leave space to understand that there is a mind-body connection here when it comes to a lot of things with regard to our hormonal health. And I would almost be more weary of somebody that's screaming at you like this is snake oil, because more often than not, they're either trying to sell books or their own product.
And that's like where proprietary blends are the things I always like to kind of steer people away from, because it's like, they're not going to tell you what's in it. And they just say it's
know what's in it.
Know what's in it and know where it's coming from. Because like, is it magnesium, which is a good thing and real, or are you getting capsules full of like I don't know, like baby powder, like we don't know it. If you aren't getting it from somewhere that's a reputable third-party tested brand, like
Yes,
then,
important.
that's important. But like certain things like proprietary blends, like stay away from that. And the other thing is like, if you're kind of going like, you know what, I'm questioning if it's safe, that's one thing. If you're
Yeah.
questioning whether or not it is going to work, try
Mhm.
it. And if it's something that you're putting on topically, just know that like you should patch test things. Like put a little bit on, make sure you don't have a big, huge allergic reaction. Because if you have a reaction and you have it on your hand, you're for sure going to have it down there. Okay. Because this skin much tougher than the skin that's down there that's like the submucosal thing. And like I always tell people too, like if you wouldn't put it in your mouth, I wouldn't
Yeah.
put it in your vagina. Okay. It's the same kind of thing. It's like that submucosal, slippery, kind of weird skin. It's the same inside and down there. So like kind of think about it in that way. Like if I wouldn't put it in my mouth, I wouldn't use it for my teeth, I'm not going to use it for my vagina. Or if I'm not going to put it on my face, I'm definitely not going to put it, on my vagina. And like one of the things like I should specify with that though is like with boric acid supplements,
Mhm.
our vaginal pH is really acidic. Okay. And one of the problems that a lot of women do have is that they have basically pH imbalances. And so this isn't right for everybody, but the boric acid supplements that you're going to put like vaginally to increase vaginal pH, that's something you definitely aren't going to like, that's pretty specific. You're not going to put that like on your face, but just know that like what is right for you might not be right for the next person, but try things. And if it doesn't work, like give it like 3 weeks, 4 weeks. And if you notice no changes,
Mhm.
don't waste your money and move on, but don't be like afraid to try things either.
Yeah, and I think that to piggyback on that and maybe clarify something that I've been thinking about lately is I'm a fan generally, like my ethos of like living or trying to live well, everybody can always do better, I think, is often to think like the simplest solution is probably the right place to start. So if something is dry, I should moisturize it, right? If I feel like sex is painful, I need to do things to help make sex not as painful. And there's, things like a vibrator or, externally or internally or using a lubricant. These are like non-invasive things that where it's a good place to start and then build from there. Like I wouldn't personally jump straight to a laser, right? Or do something like that's going to, that could potentially have some negative side effects and also would hurt my wallet. You know what I'm saying? Like try things that have been around for a long time. So a nod to our Victorian, ancestors for, and bringing it back to the book, and just things that feel intuitively correct, right? Like it is intuitive to me that if my face is dry, I'm going to put moisturizer on it. If my vulva is dry, I should moisturize it, even if that's not something you've ever done before. I think just starting with like the basics before you kind of build on to, more intensive or expensive or invasive things is, I would say the way to go. But that's
Yep.
just
Totally
my
agree.
opinion.
Our women's intuition is strong.
Yeah.
It's like if you are going like, wow, this is just really not right. It's for you. It probably isn't right for you. But also like it's okay to get a little uncomfortable and like use a mirror or come to see a pelvic floor PT or go discuss those symptoms that you don't really want to talk about, but you know are not normal with your OB, and like know that it's okay to push yourself out of your comfort zone, but use your female intuition. And if you think something's wrong, don't let anyone tell you that like, don't let anyone like shove you aside. Don't let anyone tell you like nothing is wrong with you and like this is all normal, because it might be like common. It doesn't mean it's a normal thing. So educate yourselves, please, so that you can have these conversations better and with more confidence. Like go into the, feel like you're confident in knowing your own body and confident going to talk to your doctor so you don't feel like you're getting shoved aside.
Yeah. This is like soapboxy, but I feel like it connects things that we've been talking about today. You mentioned breast exams. The minute you said that, I'm currently breastfeeding. My boobs like instantly filled up with milk, which is like a crazy phenomenon that when you talk about something, like it can happen. And I just think that it was like a reminder for me in the moment of like how powerful our bodies are and how important that, again, mind-body connection is. And when I think about like my target consumer and what we're trying to do with TABU, what you do and normalize every day with your patients and what this book kind of brings to light and like just the history of hysteria is I get angry when I think about how our intimate health was kind of like co-opted by, porn or eroticism or things like that. And again, I'm not holding shame for people that enjoy that or want to do those things, but it's not the whole story. And it's certainly not how most of us experience intimacy. And so I think that as much as we can start to kind of break away from those types of conversations and really ground ourselves in the health aspect of this part of our life, I think the better we'll all be served. Because, back to like my boobs filling up to go feed my innocent little baby, like the thing that creates that innocent little child is not inherently dirty, right? It is just like a beautiful part of life. And the tools that are designed to support that part of your life are also not dirty, and they're also not, they're not something to be ashamed of. And some people, always question, like, why would you call your company Taboo? Like, why are you like bringing shame back to the conversation? And for me, it's like my way of acknowledging, like, I get it. I understand what it's like to live in a household or to grow up in a culture where it is super taboo and it's not something you talk about. And it's kind of our way of saying, like, we see you, we hear you, we understand that, but these things are still really important, and we want to make sure that you use these products to support your intimate health, right? Like the rest of the category is very well represented, and it's getting nicer every day. And if you want a pink and purple and sparkly, toy, it's there for you. Like, you can absolutely do it. But if you're looking for something because you're dealing with something a little bit more significant and you really want to either get this part of your life back, try it for the first time, or what have you, like, I think there's also space for you here, and I think that's kind of, to me, that's kind of what this story and like the founding of like the first vibrator, even if it's like a little bit disputed, kind of represented, because it kind of came full circle for Taboo.
And that's part of why I wanted you to come out with me, because I feel like there is like this, we're in this like women's health revolution, but also there's like these underlying threads that some of them are kind of dark or kind of maybe twisted, or, are there like questionable in terms of like the validity of like the story, right? But doesn't mean that the experiences haven't been valid of these women this whole time. And so, now it's just trying to create these communities and conversations. And I know we're gonna have to wrap this up in a minute, but like, I think with that being said, like both Natalie and Taboo and myself, we would love to hear from anyone who's here. We'd love for you to invite a friend or like tell other people that and help them to get involved, whether it's our communities or others, to be able to be part of it and educate yourselves, ask questions, know you're in a safe space, know you're in safe places where you can ask questions. And we're always trying to post information about topics that we think are important, but that if there's things that women want to know and learn more about and want to be kind of demystified or destigmatized, like we would love for you to speak up and tell us. Like part of this is it being a community, not like a one-sided, conversation all the time. And that being said, like every one of these books is picked intentionally from like different perspectives, and you might go, oh, I already know that information, but like this is a different perspective. And I can only speak for myself that every single time I pick up a book and read, I learn something new and pick up something more, that is new to me. And this is like all I do for work. And you could argue it's my biggest hobby outside of work as well. But like learn, grow, and we're happy to take suggestions for this stuff. And if you want to know about things, make it conversational, come back and let's also help to break. I don't have any children, Natalie does, but like I have a lot of nieces and nephews and stuff, and breaking these conversations and signals to these younger generations. All my cousins are in their mid-20s. And it's like, I want them to not have the same experiences that we did and make it better for every generation versus like kind of continuing to repeat down traumas that maybe we endured. We want to just start breaking those cycles and making everyone more empowered. And like without, you said, like getting more soapboxy, it's like, just want all women to know about their bodies and be empowered to their health and be able to stay healthier longer and enjoy their lives, and also be healthier younger, like these, young teens I mentioned, like I want them to not be dealing with these things at 35 that they could have sorted out when they were 12,
Totally. I love it.
And really quickly on Dr. Heidi's note of suggestions, there will be a quick little survey after we hang up. If you would like to recommend topics for future office hours or books for future book clubs, please let us know. We would love to see your thoughts.
We would love it. We love all the feedback. It's really appreciated. And we appreciate you all showing up here tonight.
Thanks, guys. Great to see you both.
Thank you for helping me with all the technical stuff and
Always.
I can't be allowed. All right, thank you.
All right.
Ladies. Have a great night.
Bye, you too.